How to manage your child's fever. Kira, an otherwise healthy and happy 18-month-old baby, started having trouble sleeping and eating. She did not look sick, but was warm to touch and acting out of sorts. Her dad decided to check her temperature. When taking your child's temperature, it is important to use a digital thermometer because they are made of unbreakable plastic. They are easy to read and quickly measure temperatures. As well, depending on the age of the child, they can be used in the mouth, armpit, or in the ear. For children less than 5, the armpit is the most effective way to take their temperature. Measurements can also safely be taken in the ear, using a digital thermometer for the ear. For children older than 5, the mouth is the most accurate temperature reading. However, the ear or armpit are also useful approaches. Normal temperature ranges are different depending on the location of the reading. The normal range is from 35.5 to 38 degrees Celsius, or 96 to 100.4 degrees Fahrenheit. Kira's temperature in her armpit was 38.2 degrees Celsius, or 100.7 degrees Fahrenheit. Her parents tried removing the extra blankets on her bed to help lower her body temperature. After a few hours, Kira became fussier and developed a rash. Kira's parents decided to take her to the doctor. The doctor told Kira's parents that she thought she had a viral infection. Fevers are common when your child has a viral infection. A fever occurs when your child's temperature is above the normal range of body temperature. A fever will not hurt your child. It is the body's normal response to an illness. Although sometimes a child with a fever can have a seizure, these seizures are not dangerous, and they usually happen before a parent even knows that the child has a fever. Most fevers go away within 72 hours. She recommended that Kira could have acetaminophen or ibuprofen if she was uncomfortable. Do not give aspirin to children. Acetaminophen and ibuprofen do not always reduce a fever and do not prevent a seizure. However, they can help to relieve the aches and pains that may happen with a fever. The doctor said this could be why Kira was cranky. The doctor reminded them to always follow the directions and dosage on the medication bottle, unless their healthcare provider tells them a different dosage based upon the child's weight, and to not give more than one medication for fever at a time. The doctor recommended keeping a close eye on Kira and that she should stay home while she has the fever. They should check on her during the night to see if she looks fine and is breathing normally. She assured them that the fever would likely go away within the next 72 hours. The doctor recommended 1. To watch Kira's behavior and appearance as a sign for how she is feeling, specifically if she appears more upset than usual or very sleepy and hard to wake up. How high your child's temperature is does not tell you how serious your child's illness is. How your child is behaving is generally a more useful sign. For instance, check if they are more irritable or harder to wake up than usual. This would be a reason to take her back to a doctor to be assessed again. 2. Ensure she is having plenty of fluids and watch for signs of dehydration. Signs of dehydration include less urine than usual, dry mouth, sunken eyes, lack of tears, and generally looking unwell. In babies, look for a sunken fontanelle, the soft spot on their head, or a lack of wet diapers. What to do when your child has a fever? Keep them comfortable by removing extra clothing and blankets. Offer plenty of fluids. If the child is breastfeeding, continue with breastfeeding to ensure they do not get dehydrated. Monitor for signs of dehydration. You can offer your child ibuprofen or acetaminophen to manage the aches and pains associated with infections. Always follow the directions on the bottle and do not exceed recommended dosages unless your doctor prescribes a different dosage based upon your child's weight. It is important to make sure your child is drinking adequate fluids. Check on your child during the night. Keep your child at home while they have a fever. Do not remove all of your child's clothing or blankets. They may become too cold and begin shivering, which causes the body's core temperature to rise again. Do not sponge your child with alcohol. Do not give ibuprofen to children under 6 months without talking to your doctor. If giving ibuprofen, be sure they are drinking adequate fluids. Do not alternate between ibuprofen and acetaminophen unless your doctor recommends it. Do not give your child aspirin. Kira's parents gave her acetaminophen according to the instructions on the bottle and ensured she had plenty of fluids. 2 days later, Kira was feeling much better. Seek emergency medical attention if your child is less than 3 months old with a fever, is having trouble breathing, is dehydrated, is complaining of headaches, neck pain, light sensitivity, or is vomiting repeatedly, has a bruise-like rash on their body that does not go away with pressure, has a seizure, is very sleepy, difficult to wake up, or confused, is cranky, irritable, or agitated, or if you do not feel prepared to look after your child during their illness. Remember that there is usually no cause for alarm if your child has a fever but is still drinking fluids, responding to your voice and facial expressions, and playing. Here are some useful points to keep in mind when deciding when and if you need to take your child to a healthcare provider, for example, a doctor's office or walk-in clinic. Is your child out of sorts, not acting normally? Have you recently returned from traveling outside the country? Has your child not been vaccinated? If you answered yes to any of these questions, you should consider getting your child assessed by a healthcare provider. If you are unsure, you can also get phone advice from healthcare professionals, for example, HealthLink. It is important to remember that a fever is a normal reaction of the body to an illness. In most cases, your child's fever will be gone in 72 hours.